Really glad today to have concluded the first day of our Global Self-Care Forum. We had an amazing attendance consisting of industry, global health stakeholders and missions.
Today at the Geneva Global Self-Care Forum, there's a massive opportunity for us to share ideals, to discuss the opportunities that self-care will unlock for us, but also to mobilise pharmacy to be a force for good in achieving universal health coverage through primary health care.
Well, we need to take self-care more seriously. Policy on self-care is very weak in most countries. And we also need to take the practical steps that will actually improve men's self-care and their health.
Empowering people is very important, but at the same time keeping regulatory standards that keep the quality, safety and efficacy of products.
Self-care is not a transfer of responsibility from governments to citizens. It is an empowerment of citizens within a strong and accountable health system. Self-care is where prevention, empowerment and equity meet. When supported by strong regulations, digital infrastructure and trusted healthcare systems, self-care becomes a cornerstone of universal health insurance.
It's been a really incredibly engaging day. We've had a lot of interest from the audience, more than 100 delegates. We had 2 really lively panel discussions. We've also revealed new findings from a brand new study about the substantial economic and societal benefits that self-care brings.
In between the years since the first study was done, we saw, of course, that there is a growth in OTC markets and non-prescription markets worldwide. By the data we show that by giving people access to self-care, they can improve their daily life, they can improve their quality of life. We have more savings for healthcare systems, we have more productivity gains for people on an individual level.
For us it was quite interesting to see that in areas in the world where there is no good access to healthcare, doing self-care with non-prescription medicines is often the only way of getting any kind of healthcare.
Our objective was to bring people together to understand the importance of self-care and how we could work together in order that we could promote self-care. And of course, key today has been the partnership with the Egyptian Ministry of Health and the Egyptian mission here to the UN in Geneva. This has been a phenomenal partnership, and we seek to build on that as well and create a coalition of member states in order to support self-care.